The latest data on COVID-19 in this province covers a 3-day reporting period. There are 1,478 new cases of the virus since Friday afternoon. More than half of those new cases are in the Fraser Health region, and 8 more people have died in the last 72 hours. There are currently 236 people in hospital. 65 are in intensive care. The province has also rolled out its strategy for getting as many people vaccinated as quickly and efficiently as possible. Our Liza Yuzda has more on that tonight.
By mid to late July, that we will have been able to give a first dose to everybody in our population, which is a significant shift from our earlier plan out into September.
The province is making changes to BC's vaccination plan, moving up the end date by more than a month and bumping up some first responders and essential workers ahead of their scheduled age group. It's all thanks to another option, AstraZeneca, and remarkable vaccines.
The protection that we're getting after a single dose, once your body's immune system responds to that, so at about 3 weeks, is about 90%, even in long-term care homes, our most frail elderly. This is an amazing news.
And allowing BC to extend the distance to the second dose up from the current 42 days.
We are now extending the interval between our first dose and the second booster dose of the vaccines, the Pfizer and the Moderna vaccines, as well as the AstraZeneca vaccine, to 4 months or 16 weeks. In combination with the new vaccines that we have available, this gives us a very important and very real benefit to everybody here in BC. That means we can move everybody up the list and more people will be protected sooner.
So first shots for all British Columbians now in July instead of September, and frontline and essential workers prioritized ahead of their age group.
First responders and our key essential workers who are not able to work from home. And we've had a number of places and communities around the province where we've had outbreaks. If we think about things like poultry workers, people who work in some of our mail distribution centers.
This group will be targeted with the AstraZeneca vaccine, as for now it's only for people under 65.
They will have a choice to receive that vaccine in the near term or to wait for their age group to receive the Moderna or Pfizer vaccine. So we obviously encourage people to get the vaccine that's available to them as soon as possible.
Decisions on which workers will be in that priority group expected next week. First, to get to the 175,000 British Columbians 80 and over chomping at the bit to get their shot.
So we are going to divide our over 80 population into subgroups based on their year of birth and their corresponding age, in order to not overwhelm our call centers right off the bat, because we've seen that happen. And we can protect to a certain amount against that, and we know our public is going to want to cooperate so that we can get our elders in the community vaccinated.
This means don't book until it's your turn. That's people 90 and older can start booking on the 8th, people over 85 on the 15th, and 80 plus on March 22nd. There will be dedicated numbers in each health region, those numbers coming out later this week, and an online platform expected in April as the province continues to vaccinate backwards in 5-year age groups. Now, the province also confident, they say, that supply will continue as expected, according to what Canada has ordered. But in the meantime, asking for your continued patience.
Although there is light at the end of the tunnel, we are far from out of this. We have months to go, and I want British Columbians to take the good news we're hearing today with the joy that it deserves. But we need to remind ourselves, not just today, but next week and next month, that we have a long, long way to go.
For City News in Victoria, I'm News 1130's Liza Yuzda.